Hi, Professor. This is Cecilia Njome. The following techniques were used to change Jill's thought pattern through cognitive behavioral therapy, in brackets CBT. They use the technique of the Socratic questioning, which critically examined Jill's thought and belief about the traumatic event and challenging distorted perceptions. They also use the technique of psychoeducation about the protocol in convoy situation and the realities of detecting improvised explosive device. Okay, there was also the technique of challenging thought, the use of challenging thought worksheet, which was used to introduce uh, in therapy with Jill. It's like this challenging thought worksheet kind of encouraged Jill to identify uh, thinking errors and gather evidence for and against her maladaptive behaviors and thoughts. Again, the homework assignment was another technique that the therapy used with Jill, uh, which work in completing challenging thought worksheet to reinforce cognitive restructuring skills and promote long-term behavioral changes outside of the therapy session with gel. To implement CBT into my clinical practice in the future, I think I will first undergo specialized training or continuing education in CBT techniques for mental health disorders. Then from there, I can integrate CBT principles into my assessment and treatment plans using techniques such as the Socratic questioning and cognitive restructuring during therapy sessions with my patient. Again, I can collaborate with other mental health professionals or seek supervision from experienced CBT practitioners to enhance their proficiency and effectiveness in delivering a CBT interventions. Dialectic behavioral therapy can be used in the following mental health diagnosis, like borderline personality disorder, patients with depression, anxiety disorder, PTSD, eating disorders, substance abuse disorder, bipolar disorders, even chronic pain, and patients with self harm and suicidal behaviors. In my current clinical encounter, some sessions have included CBT, though briefly. Yeah, most of the patients are being referred to experience psychotherapy, where for them to undergo evaluation and management with for CBT. Yeah, with this referral, they can have 3 to 4 sessions per week. And then I've not really had like CBT session with like a full session with the patient because sometimes I do a little bit of counseling and medication management. But for them to get a real therapy, CBT therapy, will make the referral for them to for psychologists or with specifically CBT. In most of my encounters with patients diagnosed with depression, PTSD, anxiety, insomnia, and bipolar disorder, I always encourage them to express their current thoughts and feelings by providing a safe and non-judgmental space for them to share their experience. Thank you.